AI just seems to be something that everyone knows about. It's a constant buzzword and probably one of the most talked about topics. But how does this relate to your med school interviews? Especially if it's a topic that loads of people already know about and talk about so much, how can you stand out when you talk about it in your interviews? In this video, that's exactly what we're going to look at. We're going to go right back down to basics, looking at what AI is, then we're going to take a look at its applications in medicine and looking at different answers that you can actually use in your med school interviews to stand out, so not everyone is just saying the exact same things about AI. Hi, I'm Loveleen, a medical student at King's College London, here to help you with your interviews. Now, I completely understand how daunting and difficult interviews were, as I was in your position. But fast forward a couple of months, I went on to achieve all 4 of my offers with interview scores as high as 135 out of 140. And I'm here to help you do the same and achieve your dream of studying medicine. On my channel, I talk about all things relating to medicine, entrepreneurship, and mindset. Now, to help you, I've also created loads of different resources. First up is my Aspiring Medics newsletter for completely free resources. On this, I post loads of different tips relating to the journey of getting into medicine, especially around during UCAT season and interview season, and what you can be doing to help you achieve your dream of studying medicine. Additionally, one of the key reasons that I was actually able to get all 4 of my offers was my interview document. This is an over 50-page document in which I've included all of the content that you need to know, ethical pillars, over 100 different types of questions, and also the NHS hot topics and research. If you're interested in this, make sure to check it out using the link below. Additionally, if you want more personalized support with helping you get your 4 out of 4 offers and studying medicine at your dream uni, then check out my interview course. Again, as part of this interview course, you get personalized, tailored learning given to you about all the content, learning how you should actually be structuring your interview responses, what your interviewers want from you when you're doing a med school interview, and the art of speaking and presentation, because this is so important in helping you secure your offers and get into medicine. Artificial intelligence is actually just an umbrella term for a computer being able to recognize patterns, think, and make decisions. Essentially, what we're trying to do with AI is make it think almost like a human and have that same intelligence, so it can make loads of different decisions and automate different processes. And this is how it actually has potential in medicine. So what are some of the potential applications of artificial intelligence now that you know what it is? The first is actually incorporating into robotic surgery. So already in surgery, we often use robots to carry out different procedures, as this can make it more accurate and more easy for surgeons to carry out these procedures. But if we also add AI to this can actually reduce the risk of any errors occurring and actually improve patient outcomes, especially after surgery, as risks can be identified by AI, and even using the help of AI to actually carry out the surgery by taking advice and instructions from it, and loads of different other ways that it can help as part of the surgery. AI also has a significant role in research. It can be used to identify new drug developments and actually create new ideas for how we can work against different diseases and use existing medications, or even discover or work on new medications in order to target different conditions. This is really beneficial because it means better and new and possibly even more effective medications or treatments could be developed for conditions, or for ones that we don't even have a cure for yet. AI also has significant potential in the diagnosis and treatment of different conditions. For example, there have been studies conducted which look at how AI has been used to actually detect cancers in different x-rays or different scans. This is so beneficial because some of these cancers aren't even yet visible to the naked eye. So this is really useful in the prevention and identification of different conditions. Additionally, AI can also be used to create really personalized treatment plans that will have the most effective improvement on a patient's quality of life and make it as catered and personalized to them as possible. On the note of personalizing care as well, AI can actually be used to administer different dosages of things depending on the person who is taking them. For example, we can change the dosages of different cancer drugs, or for radiotherapy, or even for administering anesthetics for surgery. By adjusting the dosage in comparison to who the person is who is actually receiving them, this means that care is a lot more personalized, making healthcare services so much more effective for everyone and offering that personalized care. Additionally, efficiency within healthcare systems can also be improved by incorporating AI to carry out different tasks, such as admin tasks or any other systems that need to be taken care of. If AI is able to do that, this could significantly improve efficiency and different systems within the healthcare system already. So we've looked at some of the practical uses of AI, but what actually are the advantages of this? First, it can be used to streamline different processes. As mentioned before, AI can be used within research, within different admin tasks, and this will make efficiency a lot more higher. This will really help deliver a healthcare experience to all patients that is a lot more streamlined and easier to navigate. As AI is also fantastic at pattern recognition, and as I mentioned before, there was a study conducted where AI actually tries to detect cancers in different scans. This is really beneficial in providing earlier diagnosis. By having earlier diagnosis of different conditions, this means that they're able to be treated a lot more easily, which is so beneficial for patients again. And on top of this, AI can actually also be used for more personalized care in terms of administering different drugs and different medications, again tailoring it to that individual person. And finally, AI can actually be incorporated into telemedicine and into GP consultations and different systems like that to make healthcare more understandable and easy to navigate for patients too. Even though AI has the potential to have such a positive impact within healthcare and the wider world, there are still some concerns and ethical issues that really need to be considered before fully enrolling it out into healthcare systems. The first concern is that actually AI could be subject to bias. This is because AI models are often trained on using different data sets, and if a certain data set has a slight bias or a certain opinion, this could actually be adopted by that AI system. If that AI system is then used within healthcare, that could also show biases and actually negatively impact patient care and the equality that's given or the treatment that's given across different patients. Another concern is that AI will have access to a lot of sensitive, personal and confidential information of patients. So it's really important to ensure that before enrolling AI into healthcare systems, that the data that AI will be handling is fully encrypted and that it's not going to be at risk from cyber attacks or hacking. Again, this is really important to maintain that patient confidentiality. And additionally, it's also important to consider the public perception of including AI within the healthcare system. Now, if the public does feel a certain uncomfortableness of incorporating AI into the healthcare system, that is definitely something it's important to take into consideration. If a vast majority of people feel uncomfortable with having AI have access to their data, or for doctors to be regularly using AI as part of their practice, this could mean that patients actually don't give enough information to doctors because they're concerned about this, and this could actually have a negative impact on care, which is why it's also really important to understand the public opinion and the public perception of including AI within healthcare systems. And finally, looking at the ethical perspective of including AI in healthcare decisions. AI is often based on complex algorithms, so trying to understand the decision-making of process and how AI comes to a decision can be difficult. So if, for example, AI misdiagnoses a patient, whose fault would that be? Would it be the doctor's fault who used the AI system, or would it be the AI system's fault? And this is where the ethical concerns come into play, because it's trying to understand how can you use AI in a safe manner and prevent these ethical concerns from arising, or knowing how to address these ethical concerns to ensure that AI is actually being used in a safe manner and is being more effective for patients and not increasing the risk of anything. I hope this video has helped you to understand both the positive and the negative impact AI could have in medicine, some of the different ways it can be used, and also the ethical considerations, as this is something that many students forget to talk about in their interviews. And if you want to have more information into the different NHS hot topics so you can do well in your interviews, make sure to check out the rest of my videos on my channel.